everybody, and welcome back to VetMap. And today we'll be looking into respiratory system, particularly lung anatomy. Sorry for not posting for more than a week. This September has been crazy, and the third year in vet school is definitely not easy. But I hope that the videos will come more regularly and on schedule. So just make sure that you like, comment, and just watch them in general so I know that you actually need them. So thank you so much for watching, and let's get right into this lecture. Let's begin with finding out what lungs or pulmonus actually is. So first of all, it's an parenchymal organ, which means that it has something to hold it up, and then it has the part that makes it function. So the base of the lungs is stroma, or the tree of the bronchus, and then you have the actual functioning part, which is the parenchyma, and in this case is the alveoli, and this is where the changing of different elements and different gases actually happens. So CO2 and O2 changes here. So this is the part that actually makes lungs function and do their job for the rest of the body. Talking about topography, where the lungs actually are, so it's not rocket science. They just take up most of the thoracic space. As you know, for big animals, the lungs are huge, especially when they are filled up. For smaller animals, I mean, it's not that drastic, but still, most of the chest is taken up by lungs. So, this is where they are, as in you can see like most of the space where the ribs are is taken up by the lungs. Now the color of the lungs changes depending on how much blood is in them at that moment and how well circulated they are. Now if you have some kind of pathology, the color might change. They can be very pale, or they can be very dark in color, almost like going into browns and into blues. That's not good. But from light pink to deep red, almost where you can see like this marble effect with like lighter parts and then darker parts, is normal. But if it's unusually dark or is very pale, definitely think of it as pathology. Then the size can change again depending on the part of the breathing cycle and how much air is taken in. So let's say if the horse is like, or a different animal is breathing, calmly, normally, the lungs might not expand as much. Where it was like running on a track, or a dog, let's say, would be playing in the park, then the lungs would take in more oxygen to actually supply the rest of the body, especially muscles, with oxygen and take out that residue of CO2. So this is why the size changes. And the rat lung is usually a little bit bigger. The size difference is not like that huge. I mean, it's not very significant, but still, right lung is usually a little bit bigger. We'll talk about the lung elements. There are quite a few, but they're not that difficult. So first, here we can see the costal surface, which is smooth and is pressed up against the ribs. Next, we have the apex of the lung, which is right here. So this would be the cranial part where the head would be, and this would be the part close to the diaphragm. So apex is in the cranial part of the lung. And then you have the base of the lung. So this part, and this is the part that is pressed up against the diaphragm. Next element we have are surfaces. So again, we talked about the coastal surface, or fascias costales, which is the smooth surface, and this surface and this one and this one and this one is the coastal one. Next we have the medial surface, which is basically just like the inside part of the lung, and this surface has a lot of impressions and indentations, if you will. So it's kind of hard to show on the pictures, but there are heart indentations, aortic indentations, where the aorta is um, getting out of the heart and then splitting into two, one for the head and one for the rest of the body. So it's visible very well if you have an animal open in front of you. And then you have indentation of the esophagus, also visible uh, fairly well when you have an animal in front of you. And then you have the diaphragmatic surface, but that will be in a different picture. We have oh my god, I can't say that word, the diaphragmic surface. I don't know why it's so hard for me today to pronounce this word. Sorry, English is not a first language to me, so excuse me. Um, so so this is the surface, basically the opposite surface of the coastal one, and it's very different from coastal. It's not smooth. It has all those like indentations. So all of this and all of this is the diaphragmic surface. And this part right here, which I said about indentations right before, of the medial surface, so you can see this clearly right here. So you have indentation here, you have a little bit of indentation here, and this like side would be basically the middle of the both lungs, right and left. This is where the medial surface is, and the opposite surface of the coastal one is the diaphragmic. So this, looking from the back of the animal to the front, that would be the diaphragmic surface, and looking from the top down is the coastal surface, and looking in between the lungs is the medial surface. We have some edges as elements. Now these elements that I'm talking about are not like super important, like in the clinicianal part of anatomy, but it's good to know where things are so you know what you're talking about. But it's usually the lungs are usually described in lobes, which we will talk about a little bit later in the lecture. But still, it's good to know just a little bit where everything is, and it's kind of not hard to understand because everything is more or less logical. So first you have the dorsal edge, which is basically just the top edge of the lungs, closest to the spine, if you will. Basically, top dorsal, that's all it is. Then you have the ventral edge, which is lower. So again, top, bottom, ventral edge. And then you have the sharp edge, which is basically like the lower part of the lobe, and it's not smooth. So it's like cut off like sharply. That's why it's called the sharp edge. So this would be right here. So all of this is the sharp edge. And then you have the base edge, the same as the base of the lung. So it would be right here. So the base of the edge and the actual base of the lung is the same thing, basically. Then we have the hilus and radix pulmonis, which is located right here. And hilus pulmonis, or the gates of the lungs, are basically a place on the lung looking from the diaphragmatic side where all the systems are entering and exiting the lung. So everything from veins to arteries, bronchs, nerves, lymphatic structures, everything enters and exits the lung in this area right here. But it's the site or the space or the place where these systems enter and exit, and the radix pulmonis, or the root of the lungs, is the place. It's not the place, I'm sorry, it's not the place. It's actually those systems themselves. So while hilus, gates, right? Gates, space, place, is just the space, radix pulmonis, or the root, is the actual elements. So again, the vessels, the bronchus, the nerves, the lymphatic structures, those are all separately the root of the lungs, and the place where they all connect and enter the lungs and then later on exit the lungs is hilus pulmonis. So that's the main difference. Gates, site, root, the elements. Next, we'll talk about the actual lungs on different animals. So equine lungs are the most simple. They have the least amount of lobes, and they're very smooth. It's actually hard to differentiate where the lobe starts and where it stops. So you kind of have to just point it out logically, because you can't see the separation from the costal side at all. And from the diaphragmatic surface, you can see only this accessory lobe separated. So these are just some more elements. So you have the trachea, you have the primary bronchus right here, then you have the accessory lobe, which I already talked about, and you have the aortic impression, or the groove. So you know how this would be the medial surface, right? And the aortic impression, so this would be the aorta going towards the rest of the body. So the pelvic and the stomach parts of the aorta, and to this side would be the impression going towards the head and the front limb. This is the same view of the equine lungs, only in graphic mode. So again, you have the left lung, and you have two lobes, the cranial lobe on the top and the caudal lobe on the bottom. Again, you can't really see where it starts and where it begins. Oh my god, where it starts and where it ends. But basically, like on this indentation would be like a good place to like separate them. And then the right lung is almost identical. So you have again the cranial lobe, the caudal lobe, and then from opposite to the costal surface, the diaphragmatic surface, you have the accessory lobe. Next up, we have the ruminant lungs. So everything from your cows to your sheep to goats and camels, everything. So ruminant lungs are the most complex, and they have just more lobes to them, but it's more or less the same, just a couple more elements to them. So don't be scared, we're gonna walk through everything together. Now, this is a lot of information for one slide. I'm just gonna quickly run through them. Don't be scared, it's okay. First, we have the trachea, just like before. Then we have the left cranial lobe, which will be separated into parts in next slide. Then we have the caudal lobe of the left lung. Then again, the cranial lobe of the right lung, the caudal lobe of the right lung. Then we have the middle lobe, number 5, which is visible better from the ventral perspective. So it's in the middle between right cranial and right caudal lobes. And then you have the accessory lobe, just like the horses or equine lungs had. And for everything else, you can stop the video and check one of these out one by one. I'm just gonna go to the next slide. Again, ruminant lungs, just a graphic version. At least for me personally, it's easier to understand first where everything is in drawn pictures, and then I move on to the actual like dissection pictures. So for you, I'll also put in both versions. So the left lung, again, we have the cranial lobe, but differently from the horse's lungs, you have two lobes. So you have the cranial part of the cranial lobe, and then you have the caudal part of the cranial lobe. So be sure not to mix those up, because this is not the middle lobe like on a different side, like on the right side, and this is not the cranial part, let's say, of the caudal lobe. So left lung cranial lobe has two parts, cranial and caudal. Now the caudal lobe of the left lung is one on its own, nothing crazy about it. Then we have the right lung. So we're moving on to this side. Identical to the left side, you have also two parts to the cranial lobe. So again, you have the cranial part and the caudal part of the cranial lobe. Then you have the middle lobe right here. Then you have the caudal lobe, just like you had on the left side. Again, just on its own. And then you have the accessory lobe, just like the horse had, and it's visible from the ventral perspective. Next up, we have the carnivores and pigs' lungs. So pigs and carnivores, let's say cats and dogs, have the same amount of lobes. There's one difference, which I will talk about in the next slide. So click that subscribe button for that extra information. I'm gonna give it to you anyway, but just subscribe if you like the lecture and you don't want to miss out on them. So talking about like the complexity of the lungs, carnivores and pigs' lungs are in the middle. So the horses are the most simple, then the ruminants are the most complicated, and then carnivores and pigs are right in the middle. So again, the dissection picture, you have the left lung here. It has the cranial lobe of the left lung also has two parts, and the caudal lobe is again simple on its own. Then you have the right lung, which has just one cranial, the cranial lobe is made up just of one part. Then you have the middle lobe, you have the caudal lobe, and then the accessory lobe. So that in the picture before was carnivores. I think it was dog's lungs. Yeah, dog's lungs. And here we have the pig's lungs. So again, the left lung has two parts of the cranial lobe. So you have the cranial part and the caudal part. It's not as well separated as a ruminant's would be. So it's a little hard to, again, point them out if you're like looking at them in a lab. But don't be scared and don't like lose your knowledge just because you can't see it clearly at first. But you will see those like two mounds and this like indentation. And this is closer to the trachea will be the the cranial part, and then the caudal part will be closer to the caudal lobe. So again, left lung, you have just one and simple caudal lobe. And then the right lung has just cranial lobe on its own. Then you have the middle lobe, which is again not that like separated. So sometimes I wonder why they decided to like put them into like different categories as lobes, because they're not that separated. But there are some differences, and it's just easier to let's say there's a pathology and you need to say where the pathology is. It's easier to say that it is on a middle lobe, rather than saying like it's like ventral lateral side of the cranial lobe. So it's just easier. I mean, you need to know more, you need to remember more, but it's like easier in the sense that you don't have to say so many words for just the topography of the problem. So again, you have the middle lobe, then you have the accessory lobe again on the ventral perspective, and then the caudal lobe. So basically the only difference from the ruminant's lungs is that the cranial lobe of the right lung doesn't have parts. It's just plain and simple. And then from the horse's perspective, you don't have parts of the cranial lobe of the left lung, and you don't have the middle lobe. And that important information that I was talking about, the only difference in the lungs apart from size, that pigs have a tracheal bronchus, which enters the cranial lobe of the right lung. So this is where it enters. So carnivores don't have that. They don't have the tracheal bronchus at all. So it's important to remember not to think of it as a pathology if you see that the trachea goes down and there is like another opening apart from just two bronchus like ways. There's another one that goes out into the cranial lobe earlier than the rest of the bronchus. So it's an important thing to remember. And then you have the literature and other sources as always. This site is where I took all my dissection pictures from. There are also videos and more pictures, so definitely check this out. And then a good book, not only on anatomy, but also on physiology of farm animals. This one, I do recommend it. It's very big, but there is a lot of good information. So thank you for watching, and I hope to see you next time. Bye!